Welcome back to the Nursing Post podcast, All Nursing All the Time with Ashley and Rosa. Today we discuss the most recent updated CDC guidelines for healthcare workers, which of course was released by the CDC here pretty recently. Of course, our goal is always to inform and to start conversation.
A lot has happened in the healthcare world and around the whole world in general. Right now, we're on our third known COVID-19 variant. And there are probably many more variants that we're not even aware of at this point. While America and the world were kind of attempting like a new type of normalcy, the CDC has just released, again, updated guidelines. So today we want to discuss those updates and the implications.
The guidelines that come out from the CDC are continuously changing, and they absolutely should be, because that's what we do in the healthcare world. We learn new things, we have studies, we update guidelines. This happens
scientific method.
Yep.
Scientific method. We apply reason and logic.
It happens all the time, and nobody's fussing about it because there's reason and logic behind it. There's studies. And that's exactly what you want, because you want to know what's the best, the most effective, and the safest treatment options for any kind of chronic illness, disease, anything. That's what we do in science.
Listen, if Trump just got on board, that says something.
I did see that interview, or a snippet of that interview, which I know you would be proud.
He's gotten his booster. Like, if he's on board, I'm just saying.
And I mean, I do respect people's wishes. I am a firm believer in vaccinations. I'm a firm believer in looking at the science. I was not, I think I've said it before, I was not the first one in line as a healthcare worker to get a vaccine. I wanted to read the research, and I did. And that's something that I always encourage other people to do as well.
It's your body, your choice, and I'm just going to leave it at that.
Right. Looking at the guidelines that just came out, which we're going to discuss in a little bit later, I wanted to kind of like rewind a year.
That makes sense. Go back to the very beginning.
Well, not quite the very beginning, just a year. And this is all paraphrased.
Well, it is now 2022.
Well, yes, I'm going back to December of 2020. But these are kind of paraphrased, but all this will be, of course, we'll link it, but this is all on the CDC website. So this is who's making these calls. This is who all of our employers and facilities are following these guidelines set by the CDC.
Along with the epidemiologist for your state.
Right.
Yeah.
So in December of 2020, if a healthcare professional, if a healthcare worker had a exposure, it was recommended that they be excluded from work for 14 days. Now, when you're talking about these exposures, that means that you were within 6 feet of a patient that was known to be COVID positive for more than 15 minutes. And this would be without wearing like your N95 or your PAPR or something like that, because we know that the nurses that have been taking care of these patients are not working a day and quarantining 14, but they're under strict kind of PPE that is specific to make sure that those particles do not enter them. So as long as they're wearing their PPE appropriately, they are safe, which is...
Yeah, not only that, we don't work, well, we try not to work 24/7. Right. So, some of us were going home, a lot of people were still living their best life. So they may have not even picked it up, at work. Right. I know there were a lot of people, where we worked in the beginning of this that were still living their best lives and had contacted it outside of the workplace. That was the guideline. You were out for 14, whether you caught it at work or not.
Right. Then in February of 2021, I want to say this year because, 2022 hasn't sunk in yet, but in February of 2021, work restrictions for asymptomatic healthcare providers that had a high risk exposure who had previously recovered from an infection within the prior 3 months didn't necessarily have to quarantine. So the work restriction, part of that was based off of vaccine status, which at that point you would have had 2, or the one Johnson & Johnson. But they were still kind of being very cautious with these people, even if they were vaccinated, that had these higher risk exposures, that, to see which way they went. So you could see where all of a sudden it was 14 days to, we probably need to, take this on an individualized basis. March, they said that asymptomatic healthcare providers who are fully vaccinated and had a high risk exposure do not need to be restricted from work. With
Of course, you always have those little caveats,
Yes.
those exemptions and
Yes.
things like that.
Exactly.
It's so funny to me because this, I feel like, was the time in which we were all feeling like discombobulated, because each week it seemed like there was just like new information and a new direction. And we just didn't have all the facts.
Right. So we went a little while between February and March. It was September when they released the next update, saying that combined information from the CDC addressing when healthcare workers with COVID infections could return to work, and work restriction with high risk exposure to COVID. So pretty much what they're saying is that just because you had a high risk exposure didn't mean that you didn't need to come to work.
Well, we have to remember too, and I don't know, if everybody's job is doing it, because I'm under the impression that everybody that's a medical facility is supposed to be doing it. Every day you go to work, you're still supposed to be checking your temperature. You're still supposed to be, checking off whether you have any of these signs and symptoms for tracing purposes.
Right. And so I'm like, okay, doesn't matter if you have a high risk exposure or not, you can still go to work. I'm like, okay. So at that point, you can just see where they're just like, well, no, just go ahead and work. I mean, these are for healthcare professionals that are taking care of sick people. And most of them are compromised because they're sick.
No, and I totally agree. And I know we'll get into this a little bit later, but I think we also have to keep in mind, like, even before COVID, we were already short-staffed and had a shortage.
Yeah.
So, like, I know we'll get into it later.
Yes.
But, I think that's why some of the restrictions have kept
decreasing,
lightening up, you know what I mean? Being more loose, less restrictive.
Well, and I know it's kind of been talked about a little bit of everywhere, but on December 23rd, the CDC released their most up-to-date guidelines. And I think that
this is not even 2 weeks ago.
No. And now, honestly, the only thing that I could think of is, I think for the most part, you just pissed off like 90% of your healthcare workers, but nonetheless. So, and this one says, asymptomatic healthcare workers who have high risk exposures do not need to have work restrictions if they've received all the COVID vaccines, which includes their booster dose. And as long as they don't develop symptoms or test positive. You're like, okay, that sounds reasonable. They don't have symptoms, they don't have a positive test. It's not saying that you need to test. It's saying if you don't have a positive test. And most employers, I know mine, isn't requiring us to get tested even if we're sick.
So where I was before, if you had symptoms, you were required to be tested.
Yeah. I worked with a person the other day that, she was not feeling well. There's just no way around it. Now it's that time of year where people catch colds, they feel bad, whatever.
Flu,
it's all there.
Out.
But sure enough, nobody said you need to go get tested. It's pretty much gone around my entire office. I'm the only one that hasn't gotten it. So,
well, I also think you're a lot more responsible. Like I said in the beginning of this, and still to this day, like, people are out there living their best lives like this is nothing.
Right. Well, that's very
especially
true.
Those who aren't, vaccinated. And you can see on the news, if you turn it on today, that yesterday was one of the largest days of positive cases because people were gathering at the holidays. And so, people that were having Thanksgiving with large amounts of people, came back last week positive, and then you have Christmas, and then you have New Year's. So I'm sure the cases are going to continue to climb.
Yeah.
And I want everybody to live their best life, but you can't live it if you're dead.
Well, that's very true. But the CDC did state something else, which is, just disturbing. And again, we'll link these.
Our links and references. Yeah, like we'll always put our references on
We'll have
our
a direct link to this page on the CDC
absolutely.
website, so that way you can get to it if you want to look at it yourself, which I encourage that you do. So right now, which is I think what has everybody kind of upset, is the CDC also stated that if there was a quote staffing crisis, end quote, which would be determined by your organization, there are, and another quote, no work restrictions with prioritization considerations, for example, asymptomatic or mildly symptomatic.
This is kind of funny to me, because when we work on our episodes, we're not working on just one. Sometimes we have, like in my brain and in real life, multiple tabs open.
Yes.
So we talk about a lot of things here coming up in this year's episodes, but this right here, it is very upsetting as a nurse. Yes. Because we are taught that our license is everything, and that we have to protect our license, because that's first and foremost. You and I both know nobody else is going to do it. When your name is like submitted to the Board of Nursing, it's not your place of work that's going to go and stand in for you. It's you. And whether it was the doctor, the facility, or both, chances are they're not going to be in front of the board. Chances are 99.9% of the time it's going to be you, the nurse, whether it was your mistake or not.
Yep.
Whether you took a directive from a doctor or not. So this, to me, it does upset me. It does, it's just ridiculous, because we already have issues with our places of employment.
Yes. From
the beginning of this, from lack of PPE, lack of hazard pay, lack of, appropriate time off when you're sick. And now you're sitting here telling us that we have now no guidance from the state, from the CDC, but now you're leaving it in the hands of your workplace, who is already shitty to most nurses.
Well, I will tell you this. So they have a little chart, which is actually kind of nice, saying that boosted, vaccinated, or unvaccinated healthcare workers that have a positive COVID test, that they were supposed to, because it went from 14 days down to 10 days. You have 10 days that you should quarantine, or 7 days with a negative test if you're asymptomatic or mild symptomatic with improving symptoms. Okay, great, fine, whatever. We know that 2 days before and like 2 to 3 days after is when you do the most shedding of the virus and you're most contagious.
Absolutely.
Not that you're not contagious at other times, that's when you're most contagious.
Correct.
Now, the next step over is called contingency, and that's 5 days with or without a negative test, and if asymptomatic or mildly symptomatic with improving symptoms. So 5 days, pretty much whether you have symptoms or not, and whether you're test positive or not, you can go back to work. I'm going to tell you, the day after this drops, I got an email from my employer saying the CDC has now decreased to 5 days. So we're already in this contingency setting, because the CDC keeps putting on all their website, as I'm sure this is a cover their ass kind of thing, that you should
absolutely go, so they can't be sued by workplaces.
You need to go in a tiered fashion. You can't go from conventional to crisis. You have to go from conventional to contingency to crisis. You have to go in that order. So they drop this, and the next day we're already in contingency already.
Yeah. No, this is what's funny to me, because I came from assisted living. Mm-hmm. We had, someone who didn't feel well. They came in sick. I'm going to tell you straight up, it was the hairdresser. She legit felt like shit. She went and got tested once, came back negative. You and I both know it takes days to incubate this.
Mhm.
Instead of making like the proper decision and saying, you know what, I don't feel good, I'm just gonna like go home. She comes in, she does about 10 patients or 10 residents, you know, hair, mind you, in the salon, blow
Well,
dryers, the
everybody
whole
else
nine
is up in
yards.
there talking to her because everybody wants to talk to the
Exactly.
hairdresser, and
Yep. Because
that's a thing.
like I said to you before we started this, you know, the residents and the ALF, they're like, F those masks, I'm not going to wear it. And so she's in there. She may be masked, but those resident and patients aren't. She calls the next day to say that she tested positive. In my mind, I'm like, when this first started, you didn't want anybody in your salon that was positive or even had a sniffle. But you came in when you had the sniffles, turned out to be COVID, and you still saw all these residents and patients.
Yep.
So we get our guidelines not only from the CDC, but from the epidemiologist.
Yep.
Girl, I was shocked. The epidemiologist said not to test any of those people that she had seen for 5 days and not to quarantine them at all for 5 days until they were tested. So here you go. You have somebody literally in direct contact of 10 people, and you're saying those 10 people do not need to be quarantined because of the exposure. So now those 10 people are out in Gen Pop, possibly spreading it out to everybody else. And so then you have to test in 5 days. So when people come back positive in 5 days, then it's just this vicious cycle that turns into crisis. So to me, this crap right here makes no damn sense. Why are you making it harder in the end, knowing that we already have a shortage crisis? Like, why wouldn't you be confining those people for the first 5 days, test them if they're negative, then let them out in Gen Pop? I don't understand this at all.
Yeah, and see, to me that makes sense. And then the bad part is it actually gets worse, because if your facility states that they're in crisis mode, there are no work restrictions for you.
Well, hell, everybody's been in crisis mode since the beginning of this pandemic.
Well, and that's exactly what I think made me so mad, is I'm like, well, literally the day after these dropped, my employer said, oh, we're 5 days. So we're already on that contingency. I
mean, everybody's just doing what they want at this point, all willy-nilly.
Right. And then I'm just like, why in the world? Like, why is this okay? And this is my thing. You go to work with COVID, you have COVID, and you're told by your employer that you need to come to work because they're in crisis mode and they need healthcare workers to take care of patients. You go and you're working with a patient. Oh, and I should be prioritized to not take care of immune compromised patients if I'm working with COVID, which I can't even believe that the CDC wrote that. They're in the freaking hospital or they're in a doctor's office. Most of them have a chronic illness. Most of them.
Well, no shit.
While they're there.
Yeah, you're in the hospital for a reason, right? Not just to have a good time.
Right. And then I infect a patient. And because of tracing, they go, oh, well, that nurse had COVID and she was working because we were in crisis. That patient dies because they get COVID and they die because they have chronic illnesses and they were in and seeing the patient. And the family gets upset because now they're mad because they found out that the nurse that was working with their loved one had COVID, knew they had COVID, and still came to work. And now they're ready to sue.
That's the point where I was going to just bring up if you didn't bring it up. Like I said in the beginning, it's always 99.9% the nurse's fault, right? So you're telling the organizations they're in the free and clear, but yet if we don't use our nursing judgment and say, you know what, I am symptomatic and I have COVID, and if I go to work and I infect somebody else, that may kill them. Right. So then it puts you facing the Virginia Board of Nursing.
Absolutely. I mean, and then they're not going to care. They're going to say, well, didn't you know better? And you're going to say, well, my employer said that I needed to come in, that we were in crisis mode. It's going to be the nurse's fault. We're going to be the ones that are going to be
Oh
sued
yeah.
because we should have known better. We shouldn't have gone to work
We're
when we were
always
COVID positive.
questioned.
Why did you do that? Now that person's life.
Didn't you use your nursing judgment? That's all
Yeah.
I ever hear. What about your nursing judgment? Your nursing judgment this, your nursing judgment that. I've told people straight up, yeah, that's my license, and my nursing judgment says no, I'm not signing off on that.
Oh, exactly. Which a lot of people don't
And
like
at
to
the
hear.
end of the day, that's what some of these nurses are going to have to do. They're going to have to call into their employer if they are sick, like symptomatic sick,
and they're going to
and be like, I can't breathe. I'm using my nurse's judgment. I am not coming into work today because I've tested positive for COVID-19. This though opens another kind of like caveat, because then your place of employment is going to terminate you. So this is like a vicious cycle.
I'm going to be like, I have a fever. It's like
a vicious cycle though. It's like there's no reprieve here for any of us in the healthcare community, and there has not been since the beginning of this pandemic.
No, and that's what's so frustrating. It's like you were saying earlier, we've been working short before the pandemic even happened. So any excuse that these facilities have to not give you time off, they're going to take it because they don't want to pay anybody anything. They don't want to cut into their profits.
Nope.
And
it's sad. It's sad.
Oh, absolutely.
Because we already have one of the hardest jobs. I mean, all healthcare workers already have the hardest jobs. They're definitely not compensated to the point that we need to be, with the exception of providers.
Right.
So, and now you're telling us you don't care if we have 1 foot in the grave and 1 foot out of it, you still need to come to work.
And so, yeah, no, it's definitely, it's irritating. And not only is the CDC obviously showing that they do not care about nurses, which we knew this. Like, this is not news.
This is not caring for patients. But how is this good patient care?
It is not. Oh, because it's better for you to come to work and at least have somebody to take care of the patients than for them to have to be turned away.
Oh my God, just imagine a doctor having to provide medications. Oh my God, imagine that your unit manager actually has to get off of their derriere and push a med cart. Just imagine if your DON actually had to help on the floor. How about that?
And that's what I don't understand. Like, that's part of that job description, is to fill in where necessary. And another thing that's really under fire, and these actually were guidelines that were updated in October. I didn't realize it was quite that long ago, but even the American Heart Association is like, yeah, we're not really worried about healthcare workers. And I'm going to read what the new guidelines are for CPR for patients who are COVID positive or who are suspected to be COVID positive for any reason, like while we're waiting on testing to get back. And I just wanted, since we're talking about these guidelines and these changes, I just wanted to add this in here. I'm going to read this to you. Frontline healthcare providers are at significant risk for contracting respiratory illness due to frequent contact with symptomatic patients. Adequate PPE, including N95 mask or positive airway pressure respirators, that's your PAPRs, especially during aerosolized generating procedures, AGPs, can reduce the risk of coronavirus transmission. Provider risk may vary based on individual age, ethnicity, comorbidities, and vaccination status, and system factors. Healthcare organizations may need to consider redoubling efforts to maintain a sufficient supply of PPE for AGPs of vaccination of their staff is incomplete, as only full vaccination of healthcare providers ensure an extremely low rate of infection. And just as a caveat, when they say full vaccination, they're actually including the booster in that now.
Boosters now. That makes sense when they say full vaccination.
Even as immunity to SARS-CoV-2 is achieved with healthcare provider vaccination, it is reasonable for healthcare providers to continue taking appropriate precautions against COVID-19 and its variants, since CPR includes AGPs and vaccination rates of healthcare workers remain below 100%. On the other hand, this is where it goes downhill. The risk to the patient by withholding or delaying the response for cardiac arrest is extremely high compared to the much lower risk that the resuscitation provider will contract COVID-19 and develop serious illness. The risk is particularly low in the vaccinated or unvaccinated provider who provides care while wearing appropriate PPE for AGPs. Although the effectiveness of available vaccines has been demonstrated against wild-type SARS-CoV-2 and variants of concern, breakthrough infections, which are usually not life-threatening, may still occur. Boosters addressing emerging variants of concern may be required. So, it does not matter if you have appropriate PPE on or not. They're saying that delaying the time for you to start CPR is a higher risk than your risk of contracting COVID. So you should go ahead and start CPR prior to putting on PPE.
Well, what's rule number 1 of CPR?
Yeah, you take care of yourself first.
Because if you're not safe, then you can't save anybody else.
Well, and that was taught to me as a nursing student, that if you're taking care of a patient, you can't take care of anybody if you're not taking care of yourself.
Absolutely. It's so funny to me because, I'm old, but I'm not that old. But I remember the whole AIDS epidemic where people were so scared to see a drop of blood.
Yeah.
People treated them like they were lepers.
Oh, yeah.
They thought that they could catch it just by touching someone or drinking after them or eating off of their plate. Everybody was such in an uproar, and they were treated like they had the plague and leprosy. In the beginning of this pandemic, COVID was literally like a 5-letter curse word. You couldn't go to the grocery store and cough without everybody's head turning and spinning and thinking you had COVID and that you were in public trying to kill people.
Yep.
And now you're telling us basically it's okay, whether you're vaccinated or not, to provide CPR to somebody who is COVID positive.
Without PPE.
Without PPE. But the first rule of CPR and nursing is safety, your safety first.
Absolutely.
Assess the scene for safety. If it's safe, then proceed.
Right.
It's just mind-blowing to me.
And then after this exposure, according to the CDC, you still need to come to work and work when you're COVID positive, because it's only a matter of probably a week before all the hospitals go into crisis mode.
It's just crazy to me because still, and not that I'm surprised, I think the moral of the story is this: if you are a healthcare worker, you need to use your nursing judgment, your healthcare worker judgment, because at the end of the day, it will be you that has to go before any board that you are licensed for. And
Absolutely.
Once you accept responsibility for any type of assignment, whether it's, 5 people without COVID and you have COVID, or the other way around, you're going to still be responsible for any unforeseen, unexpected, or detrimental outcome.
Mm-hmm.
So that's my advice, is to make sure you're using your nurse's judgment. And you know what? It's okay to say no. It's okay to say no. And I understand nobody wants to lose their job, but I would rather be fired for doing the right thing than not have a license for doing the wrong thing.
Oh yeah, because then you won't be working anywhere.
Thank you.
And we're in a country where people, I feel like, look for people to sue. They almost,
Yeah,
I
we're
don't
so
like
happy.
yeah, I mean, really. So, and it's always a nurse's fault. We've actually talked about that on a podcast probably last year sometime, where it's always the nurse's fault, no matter what's done. Doesn't matter if the doctor put the order in wrong. It doesn't matter about this. Why didn't you question it? Why didn't you do this? It's always the nurse's fault. And it's
Well,
really frustrating to me that people that are supposed to have our backs
don't.
don't.
Your organization's not going to stand up for you.
No.
You're the doctor who wrote the order wrong that you called and clarified twice with. Like, you could have done absolutely everything right, and it's still going to be you. So that's why I'm like, it's okay to say no. It's okay to say, I don't feel comfortable doing this, and, have another nurse step in. I'd rather, like I said, be fired for doing the right thing than staying on doing the wrong thing and knowing that my license will be in jeopardy and I won't be able to work as a nurse without it.
Absolutely. That's going to conclude today's episode of all the guideline updates that we have. If you have any comments or questions or concern, please leave them. You can find us on any platform where you can find podcasts. Next week, we'll be talking a little bit about nursing rights and our code of ethics. So stay tuned for that. And we thank you for listening to the Nursing Post.